The advantage of cord blood is you don't need to have the cells so closely matched. So if you've looked at the adult panels, of which there's now 18 million donors, and haven't found a donor, looking at more adult donors probably isn't going to work. But because you don't have to match cord blood so closely, you can take something that is less closely matched, and therefore you're more likely to find a cord, not fully matched, but that you can use. And so we started to use cords when we couldn't find an adult donor, and one of the things we found very quickly, and actually a very significant surprise, was that these children fought their virus infections, which is a sort of almost a normal occurrence after transplantation, better than the adult cells. And because this was new, we looked at this more closely and trying to understand why it happens. We know that if cells can fight viruses, they also may be taught or directed to fight leukemia cells. The process of graft versus leukemia and graft versus viruses is sometimes quite similar. So we understand, or we're beginning to understand, how the cells can fight the viruses. And now the question is, are these cells already fighting the leukemia in a better fashion or a stronger fashion than marrow? Or is the potential there for them to do so? And do we, for instance, need to give the cells a vaccine to see in order to steer them?